What we're looking to see on those scans is that we are growing a nice group of follicles together. So your doctor will provide you with a tailored and bespoke treatment plan, and all of our patients have that. So the month leading up to the stimulation phase of treatment might involve different medications from patient to patient. However, the stimulation phase, which normally takes place over about 2 weeks, is more or less the same for all patients in terms of when they're expected into the clinic and how often they would be coming in. That phase normally starts with your period, and what we would expect is that you would have your day 1 would be the first day of full flow bleeding. We'd then bring you in for a scan on day 2 or day 3 of your cycle, and we'd be looking to see that your lining was nice and thin and your ovaries didn't have any cysts or anything concerning that would mean that we couldn't start treatment. That evening, the nurses would give you a call and they would confirm that the doctors had reviewed that scan in our daily review meeting and that you were okay to start your treatment cycle. You would start with your medication that evening and you'd take it for 2, 3, 4 days, depending on the doctor's review, before coming back in for a scan to see how your body is responding to treatment. From that point, your scans are normally every 2 days, and we may also include blood tests if it needs to give us a little bit more information about what we are seeing on the scan. As I've mentioned before, we're quite tailored, so it may be that the doctors are asking you to tweak your dosages of medication and maybe add additional medication in order to optimize the outcome of your treatment cycle. All in all, from that first scan through to the point of egg collection, you are looking at about 2 weeks and would need you in the clinic 4 to 5 times for scans during that period. What we're looking to see on those scans is that we are growing a nice group of follicles together. So whereas in a natural cycle, your body would recruit one follicle and grow it at the expense of all the others, the purpose of an egg freezing or an IVF cycle is to try and grow a nice group of follicles together. At the point that we think that those follicles are going to contain mature eggs, we would trigger you with a medication to ripen and mature those follicles. We would then schedule your egg collection for 36 hours after that trigger injection. So if you're taking your trigger injection at 9 p.m. on a Wednesday evening, we would be scheduling your egg collection for 9 a.m. on a Friday morning. You'd come into the clinic on that morning, usually about half an hour before your procedure. You'd meet the nurses, your doctor, the embryology team, the anaesthetist, make sure that everything is good and ready to proceed with that procedure. It's always under deep sedation, so you're fast asleep, and it's a very quick procedure, usually about 20 or 30 minutes. When you wake up, you'll usually feel very well very quickly. It's not like having a general anesthetic where it's really hard to wake up. You will usually feel very well and ready to leave the clinic within about an hour. You'll know before you leave the clinic how many eggs have been collected. And if you're having an egg freezing cycle, you will get a call that evening to tell you how many eggs have been frozen. If you're having an IVF or ICSI cycle, the embryology team will fertilize your eggs later that same day, and they will call you to let you know the next morning how many of those eggs have fertilized successfully. They will then give you a call 5 days later to let you know how many embryos are suitable for either biopsy, freezing, or transfer, depending on what your treatment plan is.